welcome back, Internet. This is my high school bedroom. Not that that's very important. I just thought I'd mention it, or at least what's left of it. So I'm back at my dad's house, and it's been about 2 weeks since surgery. And I just kind of wanted to recap of like how the last 2 weeks have been going. So, surgery was on the 3rd. It is now the 20th, so it's been a little over 2 weeks. But I kind of just wanted to go over everything. Day of surgery, it's a pretty good day, honestly. Like, woke up, went to this hospital, got there pretty early and just kind of waited. Met the surgeon, or, well, I already met him, but, like, talked with him. Met the anesthesiologist, met the nurses, got situated, and, honestly, like, we're just getting ready, getting the IV put in and everything, and, I made a comment to the anesthesiologist. I was like, yeah, let's just rip this Band-Aid off, because that's how I felt. I was like, let's just do it. He thought that was really funny, which I'm not too sure why, because I just said, let's rip the Band-Aid. And he just, like, walked away, and he was laughing, and I was just like, well, at least he's in good mood. That's a good thing. But, that was honestly, like, I wasn't nervous. I think I've just been waiting for this for so long that, like, it's been, like, 18 months. So I was just like, let's just get this over with, like, let's just do it. And so we just got at it. So right before surgery, the anesthesiologist gave me something to help, like, just, he asked me if I wanted to, like, something to just help me stay calm, and I was just like, yeah, sure, why not? Like, let's go for it. I can't remember exactly what he gave me, but he told me my head would just, like, get kind of cloudy or foggy, and honestly, I just fell asleep. Like, I don't remember anything. Like, I just remember, like, just laying back, and then next thing I remember, I'm just, like, laying forward, and I'm in the recovery room. My parents are, like, sitting at the end of the bed, like, they had chairs there, and I just, like, kind of looked around, and I was like, oh. And I remember, so when my bite was like this, my very technical diagram, where my upper teeth and my lower teeth did not touch, I remember I could stick my tongue through the middle, and I was, like, sitting there, and I was like, hey, my tongue's not going through anymore, like, alright, that means we're good, like, and we did what we needed to do. So I'll show you guys what it looks like at the moment. So, as you can see, like, they're, upper teeth are over the front, the lower teeth. So that's what the surgery was supposed to do, and it worked. So that's awesome. I had a lot of confidence with my surgeon anyway, so, like, I wasn't too worried. But it is kind of cool just to see, like, hey, like, we were here, now we're here. So that was awesome. But yeah, I remember I had ice packs on. I have some pictures I'll show. But yeah, the weird part, not weird, but so they had to stick a breathing tube down my throat, and the reason is, like, they're doing stuff to my nose, they're doing stuff to my jaw. Obviously, those are the only places you can breathe, so they would put a breathing tube down. And while they had that down there, blood was, like, getting into my lungs, and so when I woke up, I just remember just throwing blood up, like, just, like, dark red blood. Not that you guys need the visual, but and just had these little barf bags, and I was just filling them up. I filled up like 2 of them, not all the way, just, like, put some blood in there. Like, all right, let's swap this out. And they gave me this little vacuum straw eventually that I just, like, would put in my mouth and just suck blood out, which honestly was super helpful, like, super helpful. But the nurses kept giving me a nausea medication to help control that a little bit, just because, like, it was pretty bad. It was like it was like hangover status throwing up. Like, it was rough. And but other than that, everything was fine. I was taking pain meds. The only place that it hurt was, like, right here, and I wasn't too sure why. Except when I got my X-rays taken, it was like the brackets go, like, from here down and over, and same on this side, which is kind of cool. I mean, the X-ray photo is pretty cool. But so anyways, so that explains why it hurt there, because, like, that's where the bracket was. But I remember telling the nurse, I was like, it hurts just right here. Like, I don't know why, because, like, we didn't do anything there. And she just she just gave me the pain med, and she was like, okay, yeah, whatever. Super nice. She was super nice though. So they were taking good care of me, and I was able to drink out of a cup like a couple hours later, and they gave me some pain meds, and they gave me a lot of Ensure. They were trying to get, like, nutrients back in me, because I just lost a whole bunch of blood and not eating anything, so that's what pretty much was sticking to Ensure. When I got left the hospital and I went to the Airbnb, I was mainly drinking, like, apple juice, protein shakes, and chocolate milk, because, like, why not? I'm a child, and it's a great time to drink chocolate milk. Like, when isn't? So that's mainly what I was doing. To get food down, I was using this 10 millimeter, not millimeter, sorry, 10 milliliter syringe that the hospital gave me, and eventually I moved up to this 100 milliliter syringe. Well, a different one, but it was just like this. And what I would do is I had this tube that came with the syringes, and I would just cut it, and I would just stick it in my mouth, and like that's how I'd get the food down, because I can like open my mouth a little bit better now. It's still a little bit hard. All of this area is numb, so I can't control any of that yet. Like if you tap in certain areas, it like tingles, but like other than that, like this, it's just numb. Like I can feel it on my finger, but I can't really feel anything on my lip. So like I know I'm hitting it, but like I don't know, it's weird. But anyways, so I couldn't really open my mouth to get like liquid in, so it was just easier to use the syringes. I tried the baby spoon and I tried the squeezy bottle. They weren't as great. Like it just the syringe worked the best for me. So that's pretty much what I did for about the first week. Was just using the syringes, maybe the first week and a half. And then slowly I like moved to just cups because it's just easier with the cup. But anyways, yeah, it was just strictly liquids. I tried blending some food. I tried blending some chicken and rice because, gains, and I couldn't open my mouth enough to get the food in. And so it was just like it hit my lip. And like when I'm eating, I don't know, this lip was a lot bigger and I like didn't know where it was. So I tried to get food in and like I just hit my lip and that was it. And I couldn't open my bottom lip because there's still bands on. We didn't change the band slightly, so it is easier to open and close now. But in the beginning, like I barely could open it at all. So there was that. But yeah, that was pretty much it. Honestly, week one, I just slept. Like I would sleep for like 8 hours. I'd wake up maybe like once in the middle of the night to go to the restroom, and I'd just drink something because I'm like I'm up. I need to get something in, and I take the pain meds. With the pain meds, like I was taking I believe it was hydrocodone. I was taking that, and if only for the first 3 days, and it was mainly not because I had pain. It was like I was afraid of the pain coming, so I was like, I'm just gonna take it just because I don't want the pain. And eventually, I switched to liquid ibuprofen, which tastes gnarly. Like definitely the worst liquid medication I've ever had to take in. Like it just I don't know what it tastes like, how to describe it, but it was just like you put it in, it was all right, and then like it'd get really really warm really really quick, and it was like just a super like bitter taste. So it was gnarly, and I ended up switching to pill form, um, probably after the first week. So first 3 days we were on hydrocodone, I think that's what it's called, and then we switched to liquid ibuprofen for the next 4 or 5 days, and then we switched to pill ibuprofen. Just and the main reason was it's easier for me to take the pill. Like I don't have that gnarly taste in my throat, so I was just like I'll just like slightly open my mouth, pop a pill in, take it, and these are only 200 milliliters, so I was taking like 5 of these. So I just like put one in, drink a little bit, put one in, drink a little bit. So it did take a little bit of time to get it down when I was only able to get a little bit of liquid in me. But now that I can like drink a whole glass of water, it's a lot easier. But even then, like there's not really any pain. I'm mainly only taking the ibuprofen just to help get the swelling down, which in the last 2 weeks it has gone a lot better. But I met with my surgeon yesterday and he told me that it's going to take a while for this to like go down. So um, uh, it's not really that fun. I will be completely honest. I'm super insecure about how my face looks. Um, just I'd like go to a store and people just like stare at me. It's not as bad now because it's like gone down. But like when I had to wear the bandage over my nose because like my nose would just bleed. Like I would drink some like apple juice or water or something, like whatever I would drink, my nose would just start bleeding. And so we had to change the bandage and ended up getting like really gross in my nostrils. And I have a pretty gnarly photo, but um so we'd have to change the bandage out and just keep bleeding, and the nurse told me, hey, don't touch your nose at all, like just like just try to clean it as best as you can and just like leave it alone because they don't want me to like basically it's a open wound. don't want me to do anything, just like try to keep it clean and go there. So eventually my surgeon, he was just like, hey man, just take a Q-tip and run it in there just to get all the like dried up blood out, which was so awesome. Like it just felt nice to have a clean face again. He's like, that was gross, but people would just like stare at me at the grocery store or like at the like we'd go somewhere and just people would look at me and it was just like I don't know. I just didn't like people staring at me, so that part wasn't too fun. But other than that, it's all right. At the first week, like day 8 post surgery, I met with my surgeon, and he actually this was probably the most uncomfortable part. Like 100% the worst feeling ever was he stuck a vacuum in my nose because my sinuses were also filled with blood, and like just my whole nose was just clogged. And so he stuck this vacuum tube up, and he stuck it up on the left side and cleaned it out, and it felt uncomfortable. Kind of felt like one of those like nasal tests, like where they stick the Q-tip up there and it's like all the way in the back of your nose. It felt like that, but like all the stuff was coming out, and in the tube you could see everything. And it was like kind of gross, but kind of cool. And then he did it to this side, and he only stuck it in like a little bit, and I was like, all right, that's not too bad. And then he just rammed the vacuum in, like all the way down my nose, and if I could describe how it felt like it went up and then like to the side, because you know how like your sinuses are connected. It felt like he started going into the other side, and I was just like, oh my gosh! And like I made this huge, like it wasn't a scream, it was just more like a like me bracing myself. It was super uncomfortable, but I was super happy afterwards. Like I could breathe again. I honestly can say I've never breathed so well out of my nose in my entire life. Like um normally when I breathe through my nose, you could hear it, but now like this nostril, like I was sitting there holding this one closed because I was like, I don't think my nose is working, but it's like I was getting air in and it was awesome. And I was like, this nostril, which is the side that we did everything on, breathes better than this side. And I was like, shoot, we should have just done both sides while we are there. But I'm super happy with how breathing is going. So gotta check my posture. So there's there's that. But that was hands down the vacuuming nose part. Like I remember like so I don't know what it is about like when you have something happen around your nasal area, but you just start tearing up. And I remember I was like tearing up, and he's like, "It's okay, everybody cries," and I was like, "I'm not crying, I swear," but it was pretty funny. The other thing is, oh my gosh, laughing hurts. Like all of the swollen area, like I don't know if it's the stitches or it's what's stretching or whatnot, but every time you laugh or smile, like it hurts like not a lot, like not like super painful, but just uncomfortable. Like it's a little bit just I don't know, just like you're just overstretching, I guess. But there was also that. I'm just trying to think of everything that's been going on. Um, Honestly though, for the most part, like I felt pretty okay. I couldn't lift things or whatnot. Like it would feel weird. Like I lifted my duffel bag up with my clothes in it, and I had like my laptop probably weighed like 15 pounds, which they told me not to lift anything over than 10 pounds. So it's probably that. But my nose would just start bleeding. Like I tried to do something, nose would just start bleeding. So I pretty much just slept the entire first week. Like I would sleep for like 8 hours. I'd wake up, try to eat or drink something. Maybe an hour would go by, and I'd just go back to sleep. Um, which makes sense. Like you need a rest. So um, so there was that, and then we kind of just chilled out. Like watched a whole bunch of Netflix, watched a lot of YouTube. Um, Try to just find movies to watch, stuff like really couldn't do anything. I will say around I think it was day 5. I wasn't feeling the greatest, like just mentally. I was just stuck inside all day, didn't get a whole lot of sunlight, so I actually ended up just driving around my neighborhood with my dad, and I remember like maybe about 5 minutes into the drive, I was like, we gotta go back. Like, I gotta sleep. Like, I felt so exhausted just from like getting out, getting into the truck, and driving around for a bit. By this time, I wasn't on the hydrocodone, so like it was totally okay to drive. Like, I guess some people wouldn't call it like okay, but it like legally we were fine. So, so we did that, and then right around day 8, when I saw the surgeon, we vacuumed my nose. Like I felt fine. Obviously, I still had the like nose bleeding issue, um, but like I felt like I could do anything and it would be okay. Obviously, I can't. Like I lifted up my dad's puppy, and like it didn't feel like my face, like a lot of the stress in my face was just like, whoa, like don't do that. So I've had a hard time not doing things that I like want to, like thinking like, oh, I could do that, and then like I'm like, ah, I shouldn't do that. Like that's not a good idea. So I've had a hard time doing that. Gosh, I forgot another very important thing. So when I would breathe or drink or anything, when my jaw was first healing, like we just got through surgery, it would click, like it would pop, like like when you like crack your knuckles and stuff, it would do that. And I was freaking out. I was like, I'm gonna mess something up. I'm gonna move something. Like this is not okay. And my surgeon assured me that it's totally normal. He says a lot of patients have that. And then I even got to in the back where we did a lot of the like there's a lot of change or adjustment. It would crunch like just like you have like chips in your hand, you just like crunch them, or like bones crunching. That's literally what it is. And that freaked me out. And so when I saw him on day 8, because I asked him the day I woke up, sorry, the following day before I left the hospital, and I was like, hey, is this okay? And he's like, totally normal. So I asked him again on the checkup appointment on day 8, and he said that it's just the bones like settling, like they're just like, like everything's adjusting to where the new position. So he said totally normal. The crunching did stop. I get a little bit of the like the popping in the back, a little bit of that still, but not as bad. Like before, it was like I would like drink and like swallow, and like it would like crunch or crack. Um, and now it's just like very rarely. So I am glad about that. But it was just weird, so weird. But um, other than that, it's been pretty okay. I've been pretty alright now. Honestly, day 8 and like on, everything's been pretty solid. I've been pretty okay with talking. Some people have a hard time understanding me. I try my best to enunciate, but it can get hard. Not everything's fine. The first week, I couldn't move my mouth up and down a bit, so that was made it a lot harder to talk. But now we've changed the bands a bit, and I can talk a little bit better, so that's awesome. And yeah, other than that, I mean, honestly, that's pretty much it. Like, this hasn't been nowhere near as bad as I thought it would be, which, like, thank God. But the diet part sucked. I've been only drinking liquids. I've tried blending things. I hope this was helpful. I hope at least somebody, got something good out of this. Or maybe it was entertaining. I don't know. Trying to watch me talk and not make any facial expression, that could be interesting. I'd be like a ventriloquist person, I think. I think that's what they call them, the people with the talking dolls. Um, but yeah, just can't really move my face. Other than that, everything's alright. I've been able to like go on walks. I've been taking my dad's puppy on walks every day, trying to get my steps in. Um, my goal right now is just to get 10,000 steps a day, and that's really just to stay active. But yeah, so hope you guys enjoyed. Thanks for your time.